Nigerian powerlifting icon Folashade Oluwafemi Ayo delivered another historic performance on the international stage, breaking her own world record and scoring a gold medal in the 86 kg category at the World Powerlifting Championship in Cairo. The 38-year-old powerhouse lifted an astonishing 168 kg, edging past her previous world record of 167 kg. Her record-breaking lift was met with thunderous applause from spectators, officials, and fellow athletes, underlining her unmatched dominance in the sport. With this lift, Oluwafemi Ayo not only extended her global record but also claimed her fourth world title, further solidifying her place among the sport's all-time greats. The performance marks yet another milestone in a glittering career that already includes 2 Paralympic gold medals. Host nation Morocco endured a tough start to their U17 Women's World Cup campaign, suffering a 2-0 defeat to Brazil in the tournament's opening match at the Prince Moulay Abdallah Stadium, Rabat. The South Americans took control early, with Evelyn breaking the deadlock in the 12th minute. Giovanna Waxman doubled Brazil's advantage in the 36th minute, putting the hosts under further pressure. Despite Morocco's effort to find a way back, Alain sealed the win for Brazil with a 3rd goal in the 75th minute, keeping a dominant performance by the visitors. And that's Sports Updates. I am Ernest Obi.
The commentary is on checking hypertension among Nigerians. It is written by Ugochukwu Koronko of our Current Affairs Unit.
World Hypertension Day was designated by the World Hypertension League, an umbrella organization of 85 national hypertension societies and leagues. The day aims at increasing awareness of hypertension because of the lack of appropriate knowledge among hypertensive patients. Hypertension, or high blood pressure, is a medical condition where the force of blood against the walls of the arteries remains consistently high, putting strain on the heart and blood vessels. Medical professionals call high blood pressure a silent killer because it can go undetected for a long period of time and lead to death. Most people who have high blood pressure do not have any symptoms. The impact of hypertension globally is staggering. According to the World Health Organization, over 1.28 billion adults between the ages of 30 and 79 suffer from hypertension, yet nearly 46% of them are unaware of their condition. Hypertension is responsible for around 10 million deaths annually, mainly due to heart attacks and strokes. Beyond the human toll, the economic burden is immense, draining billions from healthcare systems and placing heavy financial strains on families. In Nigeria, the crisis is even more pressing. Statistics from the Nigeria Heart Foundation shows that about 1 in 3 Nigerian adults lives with hypertension. Factors such as rapid urbanization, unhealthy diets rich in salt, processed food, and economic as well as emotional stress have contributed heavily to the rise in hypertension cases nationwide. Nigeria's battle with hypertension is compounded by its fragile healthcare system, which is burdened by underfunding, poor access to services, and a shortage of healthcare professionals. In rural areas where access to medical facilities is limited, regular blood pressure screening is rare. Even in urban centers, healthcare costs and lack of awareness discourages routine checkups. Furthermore, the high cost of antihypertensive medications and limited insurance coverage make many Nigerians living with hypertension unable to manage their condition. The theme for this year's World Hypertension Day is Measure Your Blood Pressure Accurately, Control It, Live Longer. The theme emphasizes the importance of regular blood pressure monitoring for effective management and prevention of hypertension. The first line of action in the fight against this killer disease is sustained public education. Nationwide, campaigns using radio, television, social media, and community outreach must be intensified to promote the importance of regular blood pressure checks. Government and private sectors must collaborate to implement widespread low-cost screening initiatives. Blood pressure checks should be integrated in all levels of health care, clinics, pharmacies, workplaces, schools, and religious centers. Clinics should be equipped to provide basic hypertension diagnosis services. Health workers must be trained to provide patient-centered care, counseling, and follow-up. Policies should prioritize the availability and affordability of essential antihypertensive drugs. The National Agency for Food Drug Administration and Control, NAFDAC, and the National Health Insurance Authority must ensure that these medications are part of basic health coverage. Eating habits, physical activity, and reduction of salt, alcohol, and tobacco use. World Hypertension Day serves as a reminder that hypertension is a growing public health challenge. However, it also offers an opportunity